Today, I'm going to talk about and demonstrate how to properly do a TCA peel. I'm going to address what TCA is good for, which percentage to choose, proper application procedures, how many layers to apply, what to expect immediately afterwards, how to use it in conjunction with skin needling, aftercare, and also some alternative methods such as using the cross and the full face TCA peel at the same time, and also layering TCA with other acids. Now that's a lot to cover, so let's get started, shall we? First, why TCA? Now TCA, or trichloroacetic acid, is one of my favorite acids ever. It is great for just about everything. Acne, hyperpigmentation, and melasma, wrinkles, and scarring, to mention just a few. What makes it so special is the fact that it can be customized for your skin. Unlike hydroxy acids that can only be applied one time, then rinse it off, TCA can be applied in multiple layers. It can be a mild peel with only 1 or 2 layers, or a very light application, or it can become a very strong peel if we apply the acid heavier or add on more layers. All these options with the same bottle. Do you see the benefit? Now, how do you prepare for a TCA peel? You always want to prepare your skin for a TCA peel. We want your skin to be healthy and exfoliated before we apply an acid. Also, if you have more melanin-rich skin, we want you to prepare with a melanin inhibitor, such as, here, let me pull one out here, our Fade Bright. You want to do that for at least 2 weeks prior to a TCA peel. Now this will help to avoid post-inflammatory hyperpigmentation. Now nothing is ever 100%, but this helps immensely. The perfect product to prepare your skin with is our retinol molecular serum every evening to even out the skin. I suggest the 0.20% for most people, or the 0.10% if you're sensitive. Now, if you have prescription tretinoin, which is also known as Retin-A, that's great too. Another alternative would be an acid serum like our Serum 15 or Serum 30. What we don't want you doing to prepare is by using a face scrub. When you use a scrub, you will press harder in some areas and leave an uneven texture. Leave the smoothing to an acid or vitamin A instead. Then, daily, protect your skin with antioxidants such as vitamin C, and always wear a broad screen SPF of 30 minimum, preferably 40 or 50. Now, if you have pigmentation or darker skin, don't forget to use Fade Bright every day. This is so important. Now, which percentage of TCA should I use? We have 4 percentages here at Platinum. We have our 7%, 13%, 20%, and 30%. Now, the 7%, we recommend that for those that have extreme sensitivity or want to use it on the eye area. And you can see our eye peel video for an explanation on how to apply that. The 13%, that's generally the best place to start, and that's what I'm going to apply today. Now, once you reach a point where you're applying 5 layers of the 13% regularly and want more action, then you can move up to the 20% we carry. Now this 30%, this is only for body usage, scar treatments, or dilution. Now I want to get all the warnings out of the way. Vitamin A can cause extreme sensitivity. This doesn't affect everyone, so if you have tough skin, feel free to use your products up to the day before you apply a TCA peel. If you are more sensitive though, stop usage of Retin-A about 5 days prior to an application. And if you're using our retinol, generally a few days before is a good enough time to stop. Now, stronger acids like TCA can cause unintended color changes in the skin. That's why we recommend that Fade Bright again, or another melanin inhibitor prior to your peel. Now, this is less likely with lighter skin tones, but it can happen to anyone at any time. Now, the higher percentages of acids equal the higher potential of this occurring. Yet another reason to apply more layers of a lower percentage instead of jumping into a high percentage. Now, don't use any scrubbing granules or abrasive sponges for at least a few days prior to a peel. This will lead to an uneven skin application, as I described earlier. Do not use needling techniques the same week as a peel. If you perform needling, wait an entire week before applying any peels to your skin. And the same thing goes for aftercare. Be done flaking 100% before you start needling again. Never apply a peel to tan skin. There's excess melanin, and that can lead to spotting. Do not apply TCA if you're pregnant. Do not apply to skin that has been waxed or shaved within 24 hours. So if you're a man, you're going to want to skip shaving the day before you're going to do your peel. Do not use TCA if you've been on Accutane in the past year. And do not apply TCA if you are unhealthy or if you have active herpes simplex. Now, you can apply the peel once you've been on a preventative prescription. Then you're good to go. When is the best time to do a TCA peel? I always suggest to apply the peel in the evening. This gives your skin time to calm down and possibly even return back to its normal coloring before you have to go somewhere. It also allows you to apply healing products that will sit on all night long, helping your skin. Now, let's get on to the application. Make sure you have your peel manual handy. And let's see, TCA, right here on page 14. Now, a quick mention. If you have extremely sensitive skin, you could still do TCA peel if you use a numbing agent. Any of the Cane products work just fine. Just follow their instructions. Now, I have a lidocaine and prilocaine cream here. It states to apply a thick layer up to an hour before a procedure. Most times this will work in 10 to 20 minutes though. Now, once your time is up, wipe it off and wash your face 2 times with one of our acid cleansers to get all the cream off. Now, on to the acid. I have oily skin, so I used our AB cleanser to wash. I washed my face 2 times and I pat it dry. Now next is prep. I'm going to wipe the solution over all areas I would like to peel. And if you don't have our solution, you can use alcohol in its place. It won't have the numbing properties, but it will still strip the skin like it needs to be. Follow me. I have a little mirror here, so we're going to go horizontally, working our way from the top down. So we're going to go across the forehead, then we're going to go down the temples and between the brows and just continue across the face, making sure we get all areas that we want to peel. Now, if you aren't applying the acid down your neck, you can just feather this a little bit. If you're going to go all the way down the neck onto your chest, which I highly recommend because at all ages, just apply everywhere until all areas have been covered. We're going to go a little bit down there. Okay, now we just toss that aside. Now it's time for the TCA. And I want to make a big point here about how wet your gauze pad needs to be. The drier the pad, the lighter the peel. We want the pad to be wet, but not dripping. So if we have a super wet, drippy pad, we will get a much deeper peel than we intended. That's because your skin's proteins have to process every drop of the solution before it can neutralize. So if there's too much liquid, it'll just keep going and going and going. So we want to wet our pad, which I'm going to do. I'm going to fold it here. I have my TCA. Wet it. That's good. Now I'm going to give it a squeeze so our application will be even this way. Now my pad is ready. So I'm going to apply the first layer just like I did the prep solution, top to bottom. Now, I'm going to go all the way down my neck, first under the jawline, down onto the neck, and I'm going to go across these freckled areas on my chest. I can always use some extra peeling on my chest. And I'm going to just wash my hands off real quick. Okay, once I'm all done applying that, I need to wait 5 minutes for the TCA to react with my skin. I'm going to set a timer, and then we can talk about a few things. Now, by the 5-minute mark, some people may see some blanching or frosting. If you see a white haze or some white speckling on some or all areas, that's frosting. It's nothing at all to fear. It's just the skin's proteins coagulating. Some people never see it, and some see it all the time. Even if you don't see it, your skin will still peel. Okay, now that my 5 minutes is up, I actually do see a little bit of frosting, and that's because I use retinol every single evening that thins the layers of skin and makes you a little bit more sensitive. So if you see some, you gotta decide if you wanna move forward. Now, if you stop here, you'll have a very light peel, which is perfect for many people. And if you have a light amount of frosting, or if you only have a little bit in some areas, like me, you can still move forward applying your next layer if you want a deeper peel. Another option is to only apply the acid to areas that don't have a frost on them. So if you have frosting right here, but nowhere else, well, you can apply the peel everywhere but where you have frosting. Okay, it is time for the next layer. Now notice I'm not rinsing. I'm going to re-wet my gauze pad with more solution, give it a squeeze, and apply it just like the first layer. And then we're going to time it for another 5 minutes. All right, need a fan. See you in 5. Now, with a TCA peel, let's say you're done applying your layers. I've done 2. I could go all the way up to 5 if I wish, but let's say I'm done at 2 and I'm ready to rinse. Let me throw out a bonus idea for you. It's called spot treating. Spot treating is when you only apply the acid to a tiny spot. Say a frown line on your forehead or your nasolabial folds, maybe some pigmentation. Here's the time where you can add an extra layer only to your target problems. Basically, hit them harder with an extra layer or maybe 2 layers. Consider that before you rinse. It might be just what you need to get the results you're looking for. Now, just to show you what I'm talking about, I'm going to do a spot treatment on this 3rd layer. I don't want to do another layer on my whole face, but I want to target the nasolabial folds and a couple lines on my forehead. So here we're just going to use a Q-tip. I'm going to dip it into my TCA, wipe it off. Now I'm going to apply it only where I need it. So I have a couple little lines here, and I really want to target these here and down here. Got a couple little scar there, little crow's feet here. You know, pick and choose. Apply this next layer wherever you need it. A lot of people might want to put it right there. A little line here. And then I still want to continue on with my neck and chest for this next layer completely. So I'm going to go ahead down with my neck. So, you know, that's the great thing about TCA. You know, with all these different layers, you can apply more to areas that are your problems, and then the areas that aren't, you know, you can just leave them as be. Now, same thing, we're going to treat this as another layer, and we need to wait 5 minutes to give it time to do all it's got to do. I can already see a line right across where I did it. I don't know if you can see that. I'll try to get a picture and close in on that. Okay, my 5 minutes are up, and I'm ready to rinse well with some super cold water. Now, I like to keep a bowl with ice cubes in here and my washcloth. because I'm not over a sink at home. So if you're over a sink, just keep your water nice and cold, and then it'll feel absolutely amazing. This is a great time to apply any targeted treatments you have. Growth factors, copper, our retinol luminosity, that will all penetrate deeply and give you amazing benefits. Now, I'm going to apply our Regenerate Epidermal Growth Factor, a little bit of our Fade Bright Serum, and I'm going to put that on. Everywhere we peeled. And then next, I'm going to put on our Luminosity. Now, we only need a tiny little bit, like about that much. And this is excellent. This is what I talked about, helping your face peel more quickly. Now, if you're dealing with hyperpigmentation or have darker skin, then that Fade Bright is definitely recommended. Now, if you like, you can apply something like our Emu Oil or our Pure Essential Healing Oil. I like to mix both of them actually to your face for soothing, hydrating, healing, anti-inflammatory, everything you need. Now, if you don't have either of those, you can use any other calming, gentle cream or oil. That's going to be just fine. So we're done. Now let's move on to aftercare and alternate application methods. Now first, let me answer a few questions I know you have after a TCA peel. First off, how long is the frosting or pink skin going to last? Now most of the time, the white haziness will go away in about 15 to 30 minutes, but it can definitely linger longer. So don't be alarmed if an hour later you look in the mirror and it's still there. After the frosting goes away, you may notice your skin is a bit pink. That's normal as well. In a few hours, you won't be able to tell you did a peel at all today. Now, I want to mention swelling. If you're applying a stronger percentage, such as the 20% in multiple layers, you could potentially see some swelling in the skin the following day. This is more common if you're applying the acid close to the eye area or if you're extremely sensitive from like Retin-A usage. A cool compress should help, and it will generally go away in a few hours. Why are my spots looking darker? Or why am I seeing dark patches? If you're already dealing with hyperpigmentation, you'll notice that they're going to become darker. This is temporary and can happen with many people. It's actually the pigment dumping into the upper layers, which is great if you're dealing with spots, because then it'll be able to flake off in the next week or so. Will this get all of your pigmentation in a single peel? Most likely not. Pigmentation runs very deep, even into the dermis, and can take an entire series of 8 or even more peels to get rid of. With peels, it's not a one and done event. Continue on and things will improve. Have patience and continue your daily treatments in between peels. Now, another reason for darkness in the skin is that it's dead skin. Dead skin tends to turn darker before it flakes away. Some people will see this and others will not. It is more prone to those doing several layers or higher percentages of acids. Just like before, the darkness will flake away once the skin starts peeling. How long will it take for the skin to peel? On average, facial skin will start to get dry and start the peeling process on about day 3 or 4 after your peel. It'll start around the nose and mouth and will radiate outwards over the course of the next 4 to 6 days or so. Now your neck and chest will take longer to flake. Generally, they'll just have a rough texture and you won't really see large flakes. Expect this to start around day 6 to 10 and then it'll go on for another week or so. Now body peeling will take up to a month to peel. It can be 2 weeks or more before you see any dryness at all. So please watch our video on body peeling to learn more about that. How can I make it peel faster? Here's where our luminosity method comes in handy. Not only does it give your skin a great boost of vitamin A immediately after your peel, but if you apply it for the next few days, it will also help your skin to peel more quickly. So we highly recommend that and offer an easy way to purchase that right on our TCA peel page. Another way to help those last bits of skin to come off is to use an enzyme mask. Enzymes only target dead skin, so they're super beneficial to apply when you want to get this excess skin off. I like to apply a mask every day after about day 5 to help remove the last flakes. Now, how often can I do these peels? This depends entirely on what percentage you're using and how many layers you're applying. Follow our recommendations in your peel manual that comes with your peel. On average, most people can do 1 or maybe 2 peels a month. Now, I want to give you some alternate methods to apply TCA. The first thing I want to talk about is mixing the TCA cross method along with your full face peel. Watch our video on TCA cross for a full demonstration here. Cross, or chemical reconstruction of skin scars, is when you use a high percentage of TCA and apply it directly into the scar with a wooden pick. We recommend the 30% TCA for this method. But how do you apply this when you also want to do a peel on your entire face? Simple. Always perform your cross method first. Wait your 5 minutes, and then you can start applying the lower percentage of TCA to your entire face, just like I demonstrated. Yes, it will get into the scars you just treated. That's okay. Remember, you can only do the cross method 1 time every 5 weeks, so you won't be performing both at the same time often. Keep track of your applications in the back of your manual. There's some blank pages there. Then you'll know when to do it again. Now, I want to talk about mixing TCA with Jesner's, which is fairly commonly done. In this combination, the Jesner's is used mostly for stripping and preparing the skin for TCA. So you're going to wash the skin and pat it dry. Next, apply a coat of Jesner's. Wait 5 minutes. Another coat of Jesner's. 5 minutes. Now you can move on to your TCA. We suggest either the 7 or 13%, and you can apply another 2 to 3 layers. Always wait 5 minutes in between. After your last layer, wait 5 minutes, rinse well, and again, apply luminosity. Okay, I believe I have gone over absolutely everything I can think of about TCA peels. Really, they're not any harder than a hydroxy acid application. You just get to apply more layers to customize it to your liking. Personally, I love that. If you have any more questions about TCA, we are here to help you Monday through Friday from 9 a.m. to 5 p.m. Eastern. You can speak directly with a representative as experienced as me. Just reach out to us. Have a great day.